I'm Dr. Joseph Kaye. I'm the owner and president of Optimal Wellness MD, our wellness medical practice here in Woburn, Massachusetts. Today we're going to be demonstrating what is called the vampire hair procedure, otherwise known as PRP, treatment of the scalp. And the purpose of this is to encourage new hair growth and to revive follicles in the scalp that may not be working very well and improve hair coverage, essentially. This is not a hair transplant. It is not using medication like minoxidil. It's using growth factors that we obtain from a patient's own blood to trigger healing and rejuvenation of the scalp hair follicles. This procedure can be used on women and men. It is very effective in women, probably because they don't have as high testosterone levels as men, so they tend not to lose hair as much. But probably 60% of women lose hair by the time they're 60, and they lose about 60% of their hair associated with menopause. So this treatment is very effective in treating women who are losing hair because of menopause. It is also very effective in treating men who are just starting to lose their hair when it's in the thinning stage, before they completely lose their hair. Now, there are cases where men have completely lost their hair, where we've done procedures like PRP, and they do grow hair back, but it works best before all the hair is gone. We have a procedure here using the M-Site PRP system, which is the best in the industry. It generates a very concentrated PRP, 10-fold concentration of the platelets. If you're thinking about getting PRP done for any procedure, you really need to ask the practitioner what type of equipment they're using and how concentrated the platelets are. They should be concentrated to a 10-fold concentration to get the best benefit, because that means you get 10 times as much growth factors delivered to wherever the PRP is being injected. We're ready to get started. I'm going to introduce you to my patient, Chris. And Chris has had 3 treatments so far. He's on his 4th treatment. We're going to show you some before pictures, but as you can see, his hair is looking really, I think, much better than it was when he first started treatment 3 months ago. Obviously, you know, it's difficult to see change when you look at your hair on your own every day, but when you look at before and after pictures, you can see a big difference. I'm going to ask Chris, you know, what motivated you to choose doing PRP for your hair?
I think you just said it in your overview. My hair was definitely thinning, and it was becoming evident to me. We tried Propecia, and when you prescribed it, you said not to expect my hair to grow back, but to expect it to pause the loss, and it did. We also tried a variety of different topical concoctions, OTC and prescribed,
Right.
and didn't see hair regeneration from that. And I thought, well, I've known about PRP and been around it because I'm in the medical technology industry, and have watched it progress for now, I think, over a decade in different uses. Knew there was some pretty solid data for this, and when you brought up that you were doing the procedure, I said, well, let's give it a try. And so here we are, and I can't see the back of my head, but I can see that it appears to me to be much thicker, even looking from the front and the sides. So I feel good about the progress we're making.
Good. I'll just add that Chris mentioned that he knows about PRP in the industry that he's in. There has been solid research done on this procedure, and some good studies have been done. Generally, they involve the same technique that we use. I think our equipment is actually superior to what was available when those studies were done, but studies have shown that after 4 treatments, you can expect about a doubling of the number of hairs per area that you're measuring. In addition, the thin hairs that have not yet fallen out but are not really contributing to your hair's appearance, they tend to thicken up and become full-grown hair. So The net effect is to have an appearance of a more dense hair coverage and more hair covering your scalp. So as you can see, Gianna is applying a topical numbing cream, a cream we use commonly for procedures that involve the scalp or the face. It's very effective. The next step is to do some local nerve blocks. So we're going to inject supraorbital, supratrochlear nerve over each eye, and then we're going to inject right next to the zygomatic bone, and then right in front of the tragus of the ear, and then we're going to inject the occipital nerves on the back of his scalp. And by doing that, we're going to basically numb all the nerves that innervate the scalp, and he'll get a good numbness. Chris is breathing a mix of nitrous oxide and oxygen. It's very helpful. It relieves anxiety. It gives you some analgesia. You might have heard of it as laughing gas. The dentists use it. Helps a lot with dental procedures. We find it's very helpful in alleviating anxiety and even providing some pain relief in patients that are getting procedures done on their face or on their scalp or elsewhere. This is the PRP, and what we're going to be injecting is everywhere that there's thinning, about approximately every centimeter. We'll do an injection. He's grown a lot of hair. When I started this procedure, you could very easily see his scalp, and now even with the numbing gel matting his hair down, you can see he's got a lot more hair, and you can see a lot of new growth of small hairs here. This was just skin when we started. All right, so we're going to start in the front. Just tilt your head back a little bit if you can. Perfect. All right. We're injecting just under the surface of the skin. This area was nearly bald. He had no hair really in this area. And after 3 treatments, he's not only have the fine hairs that were there turned into terminal hairs that are nice and thick and dark, but he's grown a whole crop of new shorter hairs that you can see coming in. So over the next few months, I would expect this will even become more full. As you can see, Chris is very comfortable. Using his nitrous as needed. I'm going to give extra in this area since that's where he needs it the most. So that's the procedure. Doesn't take long. So we'll do this a minimum of 4 times. You can do it more often if you get good results and you want to continue to see more hair rejuvenation. We always give it a month to see what kind of result we get from each treatment. So we finished the vampire hair procedure on Chris. How did it feel for you?
Well, first of all, I am very numb. The nerve blocks, the nitrous oxide, the anesthesia, I mean, I am numb. I felt a little pinch at the most, so not a difficult procedure at all from the standpoint of the patient sitting in the chair. My hair looks thicker in the mirror from the front, so I'm happy about that, and I'm looking forward to seeing what happens in the next couple months.
I'll point out that in some clinics this would be considered a painful procedure. If the practitioner does not know how to do the nerve blocks or doesn't take the time to do them, injecting the PRP in the scalp can be quite uncomfortable. So it's very important to do those local nerve blocks all the way around the scalp and then apply the topical numbing cream. And I think it's great that we have the nitrous oxide available. Not every practice does that. We found it very useful. Patients love it. It really takes the edge off. It gets rid of the anxiety and even adds something to the anesthesia. So as you can see, you know, you have a happy patient after the procedure, and that's what we want to see, as well as good results. So thanks.